Hi, I'm Harry Rock, and welcome to another edition of Westfield Council on Aging Presents. This is a special collaborative effort between Tina Gorman, Executive Director of the Westfield Senior Center, and Pete Coles, the producer of WCPC Westfield Cable Channel 15. Our topic today is the Massachusetts Senior Medicare Patrol Program, and our guest is Lucilia Prades. And Lucilia, thanks so much for coming today. We really appreciate the fact that you came from the eastern part of the state. Lucilia is the statewide director of the Massachusetts Senior Medicare Patrol Program, and it's a position that she has held since 2002. Prior to her taking her current position, she worked with immigrant and refugee communities. Lucilia has dedicated her career to working with underserved and vulnerable populations and in promoting equity in the delivery of high-quality, affordable health care. She's committed to helping everyone to be an engaged healthcare consumer. So, Lucilia, I'm really interested in this topic. I call myself a young senior, so to speak, and I'm certainly a part of the Medicare program. But as we were talking yesterday and prepping for this show, there's a lot of aspects that people need to be aware of. So let's just jump into it. And why don't you talk a little bit about just what is the Senior Medicare Patrol Program and your mission and purpose and how you serve the senior population?
Sure. So the Massachusetts Senior Medicare Patrol Program has been around since 1999, serving Medicare and Medicaid beneficiaries, their family members, and caregivers across the Commonwealth. And we are part of a national initiative funded by the Department of Health and Human Services. Mm-hmm. And there are 54 programs like ours. There's one in each state.
Oh, wow.
And one in Guam, Puerto Rico, U.S. Virgin Islands, and D.C.
Wow.
Those are the 54.
Okay.
And our mission is essentially the same. It is to reach, educate, and counsel Medicare and Medicaid beneficiaries, their family members, caregivers, life partners, anyone who's close to them, about the importance of detecting, protecting, and reporting healthcare errors, fraud, and abuse in the healthcare system. By reading their Medicare summary notices, their explanation of benefits, paying close attention to their healthcare bills, and then knowing what to do, what action to take when they recognize discrepancies.
Now, one of the things that you mentioned to me yesterday was how much money is either lost or wasted, either through fraud or mistakes or just mismanagement.
So it's a lot of money. $60 to $90 billion annually.
$60 to $90 billion annually.
Annually. And that's a conservative number because I have been in at statewide conferences where we've had the Centers for Medicare and Medicaid Services, Center for Program Integrity, come and speak. You know, the director of the Program Integrity come and speak at our conference, and that number balloons to over $250 billion if you put errors, fraud, abuse, misuse, overusage, all into the same bucket. That number can really balloon. Now, we use the conservative number of $60 billion and 60 to 90, and the number is alarming. Even 60 billion. I mean, we're talking big bucks.
That's a lot of money.
And can you imagine what programs we could have made available to our seniors across the state, across the country?
So your job is essentially to educate the senior population so that they can advocate for yourself, but also to be a watchdog, I assume.
Yes.
For fraud and abuse, and to really get that message out.
Yes, we as consumers are the first line of defense, regardless of whether we're elders or not. You know, we are the first line of defense. We should be asking, how much does this cost? You know, we should really take pride in asking those questions. And you know what? If you asked your doctor that question, he probably would say, I don't know. That's not the doctor's expertise.
Right.
And if you ask somebody at the front office, they probably wouldn't know. You know, and we want our health care when we need it, right? And but it's costing a lot of money, and we need to be just cognizant of that, and cognizant of errors, because errors in the healthcare system, not just a financial impact, they can have grave health-related consequences, and we need to be very aware of that.
Can you give some examples of just innocent clerical mistakes that can really make a huge impact on a person?
Well, I'm going to give you an example of some cases that we're working on.
Okay.
Okay, I think that always drives it home.
Yeah.
Okay.
Keep it live, right?
Yeah. So we worked with an individual recently who called our office. She had heard one of our presenters give a presentation, and she called our office because she had tried to call the hospital where she had a surgical procedure done, and the surgical procedure was done on an outpatient basis, and she was charged. Medicare was charged for an inpatient procedure that it had done at different parts of Medicare. And this had financial implications on her because she had a deductible on her Part A insurance that she needed to meet. So when she got the bill, and she got her Medicare summary notice and then got a bill from the hospital, she was going to have to pay $1,300. And she had been she's a very engaged consumer. So she had asked the question of the doctor prior to her surgery, because when she went in for her preoperative workup and to sign off on her admission papers, they told her it was an inpatient admission. And she said, "No, I'm going home. That's what my doctor told me," because she knew it would have financial implications. Otherwise, she would have upgraded her insurance. So she had asked all the right questions. So fast forward, she has her surgery. She asked the doctor. The doctor said, "No, you're going home. It's an outpatient. It's just a coding issue. Don't worry about it." Well, weeks later, a month later, she gets a bill in the mail, and then she waits for her Medicare summary notice, and it had been billed as an inpatient. Her bill actually said that they were charging room and board.
Oh, wow.
She got an itemized bill, so we told her to get all of that information. And then the facility wrote off the bill for the $1,300 some odd dollars that she was responsible for. They wrote that off. But that wasn't the right process. The process was then to reimburse Medicare Part A and bill under Part B. And so we had long conversations with this facility, many conversations, and the facility agreed to do that. And the facility cannot bill under Part B. Number one, it's not a procedure that is allowed to be done as an outpatient procedure. Okay? And it was too late for them to bill anyways, had it been allowed, because it was after a year. You can't bill Medicare after a year.
Okay.
So $11,000 later, returned to the Medicare pool, Medicare fund. That's a feather in our cap. But certainly, kudos to that beneficiary who was very engaged.
Right.
And she didn't have all the answers, but she knew enough to call somebody. On our presentations, we have a slide that says the gut test. Trust your gut. Your gut says a lot. You don't have to know all of this, because this is very confusing. There's a Medicare Part A, Part B, Part C, Part D. It's alphabet soup. They all do different things. So you just call people about it. Start by calling your Council on Aging. That's a great place to call. Call your Shine program. They are, a wealth of information. We work very collaboratively with them, and they will forward cases to us. So they will say, "You know what? You really should be calling the Massachusetts Senior Medicare Patrol Program."
Okay.
And one of the things I really pride myself in saying is that we are a very small organization. We cover a lot of a large geographical area across the state and islands. Okay, 3 women, full time, and we have but we have a cadre of absolutely dedicated volunteers that we could not do this work without. Okay, so and they will flesh everything out. They'll ask questions. They follow that consumer's concerns until it's resolved, whether it's a $11,000 return to the Medicare fund or $30 to a beneficiary. We really, they leave very little soil, terrain unturned. They really get to the bottom of the issue.
So let's, to that point, let's back it up for a second. What should individuals look for on their bill that looks suspicious? And I'm guessing that most people just say, oh my gosh, this is what I owe, and they do it without really looking at their bill closely. So let's talk about the bill. What should they be looking at? What should stand out? And I love that gut test concept.
Yeah, that gut test. When something doesn't feel right, check it out. It might not be. It probably isn't right.
Right.
So what should they look for? The Medicare summary notice that people receive in the mail every 3 months. Okay. We receive these quarterly. I don't receive it yet, but I will soon.
Anyone who's a senior receives it automatically?
Well, no. You have to be on original Medicare. Okay. So let me just back up. So there's Medicare original. So when you become eligible for Medicare at the age of 65, you go to Social Security or you do it via the internet, and you register for Medicare. You have a 7-month window to register for Medicare. You might recall that. So you get your Medicare card in the mail, and if you are not, so let's assume you're on full Medicare, you get Part A and Part B of Medicare.
Right.
And Part B comes out of your Social Security check, okay? This is applicable for a large part of the population, but not everybody, okay? So there are exceptions to these rules. If you're eligible for Medicare, this is how it works. And then you have to buy a supplemental to pay for the 20%, because Medicare only pays 80% of your healthcare costs. So if you choose to remain on original, and you need a Part D, so you have A, that you've paid throughout your work history, and you have B, which you're paying monthly, $144 something, 50 cents or 60 cents. That's the current rate this year. And then you need a supplemental, and then you need a Part D, which is for your medications, drugs. So think D for drugs, okay? If you choose, so there are 3 things you're getting in the mail. You're getting your Medicare summary notice that's going to identify any admissions, which is paid under Part A, any outpatient work, which is under Part B, and then you're going to get a different statement from your supplemental insurance, and you're going to get a different statement from your Part D. A lot of statements, a lot of paper. I am in favor of binders. If you walk into my office, there's a binder of every color on my shelves. I need to get rid of them, but they come in handy when you're trying to sort this stuff out.
Organization.
Right? Organizing this, So keeping Medicare summary notices in one, side of your binder and the rest in the other is advisable. And looking at those Medicare summary notices when you get them in the mail, and is it mine? Is it you could get your neighbors or you could get somebody else's. Rarely do we see that happen, but it has happened. Is it my Medicare number?
Oh, wow.
Right? Did I really see this doctor? Did I go to the doctor's on this particular date? You don't need to know the codes. People say to me, well, I can't read all these codes. Nor can I. And I've been doing this for a very long time. Okay? I don't need to know the codes. I just need to know, okay, did you see this? Did you see Dr. Smith on August 1st? All right? And did you have an x-ray? Okay, you don't know Dr. Clark? Well, he's the radiologist. You never saw him. He read the x-ray. So we walk people through this.
Okay.
Okay? Did you have all these blood tests done? I don't remember this. Well, let's call your doctor. We walk people through all of this.
Okay.
Okay? So, and people find this stuff out. Sometimes they forget, and that's okay. I forget too. In fact, if I don't write down, oh, I had a pain in my left side today or yesterday, and I'm going to the doctor's next week, and I want to tell them, if I haven't written it down, it's a goner. I can't remember it. So it's okay. Just write it down and ask the right questions, call the right people. And if those dates are, gee, I don't quite think I did this. I never went to this hospital. I've never been to Florida or, to New York, and I'm getting a bill from these people. What does this mean? Call us. We'll help you navigate this.
Okay. All right. So you're a definite resource to people if they have questions and if they need help in navigating the system.
Yes. And if we're not the right person, we will tell them who to call. Okay. We'll say, well, you really need to go to Shine. Okay. And here's the number that you can call. And we'll give that information to them. Because if they are living in Westfield, the number is different than the number if they're living in Arlington, Mass.
So I'm 68, so I consider myself a fairly young senior. Been in the Medicare system now, obviously, for 3 years. I do recall when I first retired, it seems like I thought I was going to have all this free time, and I found it consumed with having to register with Medicare and all the other aspects of becoming a senior at age 65. So I'd never heard of this until I got asked by Tina to host this show with you. How do people find out, and how do people even know that you exist?
Well, we do a lot of outreach through the Councils on Aging. That's how Tina knew about us, right?
Okay.
The Councils on Aging. We do a lot of presentations throughout the state at Councils on Aging, senior centers, churches. We go to agricultural fairs, health fairs. So we're busy almost every day reaching out to seniors. So as you know, this is an ever-changing landscape of seniors. We have a lot, people are coming into Medicare on a daily basis, right? So not everybody knows about us. So our outreach and education needs to be continuously done day in and day out so that everybody does in fact know about us. And I'm sure that there are people who might be watching this program today who have never heard of the Senior Medicare Patrol program. And then there are others who might have.
Right. Yeah. So you have information if people can get, you obviously have a I was on your website yesterday actually doing a little research prior to this interview, and very informational, easy to navigate. I found a lot of information on there. So kudos to you and whoever your webmaster is on the design and getting that information out. People can they get a newsletter through email? I see that you have flyers here.
We don't have a newsletter currently.
Okay.
We're just so I'm going to say thank you very much for the compliment on our website. It's an evolving tool. We have again a dedicated staff of 3, but one person primarily, Caroline, who's doing a lot of this work. But it's an evolving tool. So if somebody goes on it and they say, gee, this doesn't quite feel right, somebody should do something about this, we welcome that feedback because we want it to be a tool that providers and beneficiaries can look at and have it be easy to navigate, and be able to get the information that they're looking for, get a hold of us.
And what do people look up? What address should they look up or type in to find your website?
So MASMP will bring us right up, okay, or Massachusetts Senior Medicare Patrol. Yeah, okay. And it should bring us right up. I should let people know that we are actually located in Lawrence at Elder Services, the Merrimack Valley. We're under their leadership, although we are a statewide program, and we serve the entire state and the islands. And we pride ourselves again in really reaching people and making sure that everybody gets the assistance that they need in navigating the complexities of the healthcare billing system and the healthcare system.
Yeah, interesting. So if a person has an issue with Medicare, if they see a question, they contact you, how long does it take to actually resolve a case? What's the whole process that goes into that?
That's a very good question because it could take a month. It could take a year. It could take more than a year. It depends on the case.
Okay.
Okay. And every case has its unique aspects to it. So it's not, what we do with cases when somebody calls us with a complaint is we put it into a national database. And the database, we get their name, their address, their phone number, all of the personal their Medicare card, okay, who are they having this issue with. We put all of this data into the database. And then we figure out, well, what is really going on here? And who needs to see this? Mm-hmm. Do we want to send, is this fraud? Does it look like fraud? Immediately we would send that to the Office of the Inspector General. Mm-hmm. And, or we would send it to the Office of the Attorney General if it had anything to do with Medicaid, Mass Health. And we might say to people, but somebody might call us with a scam, and we'd say, okay, you need to call your local police, you need to call the Federal Trade Commission, you need to, call the Attorney General's hotline, elder abuse hotline. So we just guide people through what the steps that they need to take. Mm-hmm. So a case could take, it could take a month, it could take months, it could take a year, or even longer than that. We just closed cases out that were 2 years old. And so we And so what we do then is, because what we have to do is we have to put all the data. So when we get the case, we then send a release of information to the beneficiary that we can handle this for them. They send that back to us. They send us all of the documents that is, relative to that complaint that they have. We go through all of that. And then we have to wait for, so let's just assume like this woman I was referring to earlier. She then had to wait for a Medicare summary notice to come back from Medicare saying that the money had been returned to the Medicare fund so that we have money going out and money coming in. And we need to demonstrate that to the Office of the Inspector General because we can't claim any fame, if you will, or any recouped dollars if we don't have the documentation to back it up.
Oh, yeah, sure.
Right? So sometimes that takes a while. People have lives. Things get lost. I never got that in the mail, so now we have to call Medicare again and get Medicare to send it back out to the beneficiary so the beneficiary can get that information back to us. So we need to everything gets documented.
How many cases do you work with a year?
We work with approximately 30 to 40 cases a year.
Okay.
Yeah.
And there's just 3 of you, which is amazing to me.
There's just 3 of us. So case management, we have one person who is the lead individual on case management, Peggy. And I work very closely with her and with our case managers. We have case managers who are volunteers. One is an attorney. One used to be a dental hygienist. So we have a variety of people who are very committed to helping individuals navigate the complexities of the healthcare system. So we have in total, one is a nurse. So we have 6 case managers who have ongoing cases.
Wow. So you mentioned volunteers. So obviously, and I'm a former executive director of a YMCA. I've been in Y work my entire life, so I come out of the non-for-profit agency realm, and I've always preached to my staff that we need to have volunteers because the amount of funding we have for paying salaries is limiting to the number of people that we really need. We always need more help than we can pay for. Volunteers let us make that next step. And with seniors, people have time on their hands, they have expertise, they still feel productive and meaningful, and they want to give back. So I'm guessing that's where you get your volunteers from. So how do people volunteer for you? What do you look for in volunteers? What kind of training do you provide?
Excellent question. You beat me to it because I was going to make that little announcement, that a little advertisement. So we have a variety of things that volunteers can do. We have case managers, case counselors. We have people who do admin work. We have presenters who go out and present and help us with the outreach. People who make calls literally just to get presentations scheduled across the state. But our volunteers don't necessarily have a prescribed job description. Our volunteers often come to us and say, gee, why don't we do this? And that's why we're a successful program, because we have a lot of brain power in our volunteers. And we appreciate that and we capitalize on it. Just recently when COVID happened, we came home, we started working remotely on the 24th of March. And so myself and our staff of 2, so staff of 3, all the 3 of us, decided, you know what, we need to have a meeting right away of our volunteers. Because we needed to keep the momentum going.
Oh, yeah.
We didn't know where this was going to, take us. We needed to, invest in them and have us all be invested in the program. So immediately we had a conference call strategizing, and one of our volunteers immediately said, we need to create a committee on moving forward in the era of COVID.
Right.
Excellent idea, Jackie. Excellent. So we immediately put that into place. Other people had other ideas. We had a retreat that was coming up in May, and that we needed to now pivot to Zoom. Everything's gone to Zoom, right?
Right.
This is no advertisement for them, but
yeah,
but it's been really handy, right? So we immediately we got a planning committee together, so we could plan this retreat, and so we just kept, they've been so engaged, so engaged. We haven't lost volunteers. And I think that's just amazing. That speaks to their level of commitment to the project.
Wow.
Right? So we planned our retreat. We had our retreat. And people were involved with it. People delivered presentations.
Oh, wow.
So they are they're delivering presentations almost daily on Zoom to various senior centers throughout the state. So they're very engaged. We are now planning a statewide conference that's going to happen in May. We've already, put a committee together for that.
Really?
Yeah. So we utilize their expertise because they come to us with tremendous amount of expertise. Our program, I'm very proud of our program, but it's not my doing, really. It's really a team effort of our staff, yes. We keep the momentum going, but our volunteers are really the people we need to thank. Because there's no way we could be all over the state.
Right.
Well,
I always say that, the volunteers are the ones that really magnify your work, and they're the unspoken but really true heroes in our agencies, because we could not do the work and also pay for or recruit the level of expertise that many
we
of them
got.
bring.
We have a lot of brain power.
Right.
A lot of brain power, and it's really through the volunteers. So how do you become a volunteer,
yes,
right?
That's the question.
So you can visit our website, masmp.org, and there is a tab there just for volunteers. There's a volunteer application.
I saw that.
Okay.
Yep.
So you could become a volunteer if you'd like. You can fill out that application, or you can contact our volunteer coordinator, Caroline Louise Cole. And her information is also on the website. We have a tab about us, and you'll see the 3 of us on there. And you can contact Caroline, or contact any of us, but Caroline is the volunteer coordinator. And we'll send you out all of the necessary information. We just had a training for volunteers. We're planning another one. During this COVID era, we recruited 4 new volunteers.
Wow. Wow.
So
Good for you.
isn't that impressive?
Yeah, that
I
really
think
is.
that's very
The
impressive.
fact that people are still stepping up and saying,
Stepping
regardless
up.
of COVID, I still want to help.
Yeah.
I want to make a
Yeah.
difference.
Yeah.
Yeah.
I think that's I think people are remarkable if you really think about it.
One of the things I noticed on that application is the fact that a lot of times volunteers will say, well, I don't want to help because I don't want to get locked into something because it's going to interfere with my travels or going on vacation or I have a cruise, whatever those start up again. And what I noticed is that you are very flexible.
Very.
You can either questions I saw was how many hours do you want to devote?
Yeah.
Do you want to work certain days? Do you want to leave it open?
Yeah.
You seem to have a lot of flexibility
Yeah.
in how people could schedule their involvement.
Yeah, so we have volunteers who say, you know what, I really like agricultural fairs. So I'm going to do Topsfield Fair for you every year, and I'm going to do X, Y, or Z, or Marshfield Fair or another.
Oh, okay.
And so, they may join us on a call. We may hear from them. They stay on our email list because we send out information on a regular basis to our volunteers. But we know that they are seasonal, right? So we can call them for these particular fairs. This year we didn't get to put them to work because everything really got canceled. But
Right.
prepare for next year.
So you try to get to all the fairs around the state.
We try to get to.
That's a great. I never would have thought of that as an outlet, but that's a perfect outlet.
That's a great outlet.
Right.
And some of them have senior days, so it's
Yeah.
a perfect outlet.
Yeah.
Some of them are cost prohibitive, unfortunately.
They charge you.
Yeah, they
to do
charge.
that. Oh, that's
So,
a shame.
we have to sort of weigh and measure that and
Right.
figure out, can we afford it? Can we not afford it?
Right.
Can you waive the fee? I'm famous for asking that.
Oh, absolutely.
Yeah.
I mean, I would like to think that if they really see that it's a community service, you're not recruiting business, you're not making money.
Yeah, and that's true for a lot of
You're
them.
dispensing information that's valuable to the clientele that's coming. Quite frankly, you become a draw for people to come to that fair. I would think that they would want to waive that if asked.
Yeah, but
Yeah.
a lot of people are, a lot of these organizations are also, chasing the buck, and
Yeah,
they're
everybody's
hurting for money
Right.
as well.
Yeah.
So we don't. I mean, if it's we try to talk them down on the price,
Right.
try to negotiate that.
Right. But anyway, you're getting out there.
No, we
out
are
and about.
getting out there.
Yeah.
We'd love to get out, So one of the things we do on a regular basis is strategize with our volunteers about what else can we do? How can we think a little bit more outside the box here?
Mm-hmm.
So we're always trying to think outside that box.
Mm-hmm.
And the box keeps sort of growing, and that's a wonderful thing. And that's, again, because of the people who come to our conferences and the individuals who affiliate themselves with us and on a volunteer basis. And we never say, well, no, that's not a good idea. We'll try it. Let's
Right.
try it. Let's see if it works.
Right. Right.
Yeah.
So, where does your funding come from? Are you
So
a
I'm gonna
state agency?
before I get to that
Okay.
question, I just want to say that our volunteers are quarried.
Oh,
Okay, they have to
yes.
do
That's good
they
to
have to
know.
do a criminal
Yep.
record check on them. If they're going to work on cases and have access to people's Medicare numbers, they actually do. We do a national query.
Oh, fantastic.
So there's another level of check. There's
Okay.
confidentiality agreements that they need to sign with us, and that's important because we don't want people's information out there. And not that people would
Right.
do that, but there are all these measures
No, you
that
need to protect
that are
yourself.
in place.
Right.
Yeah. So that's an important piece of information for people also to have.
I've
feel-
always, that's good to hear that you're doing that. As a former Y executive, we did the same thing with volunteers, especially if they're going to be working with children. But I always said, unfortunately, there's a small segment of our population that looks to take advantage of our goodwill to fulfill their own selfish interest. And you have to recognize that there are people out there that, while they may be coming on the outside with good intentions, internally that may not be the case. So it's good for people that are interfacing with your volunteers to know that they are quarried and that they are they
Yeah.
do have background checks, and that these are people that they can essentially trust.
Well, we're mandated
So,
because we
right.
are, we're working with elders. We are at an
Absolutely.
aging service access point,
Mm-hmm.
and so the state mandates that.
Mm-hmm.
So, but there's that other layer that the Administration for Community Living, which is the funder,
Mm-hmm.
um, actually also requires that we do a national CORI, a national criminal check for, I don't think it's called a CORI, for individuals who are, who have that private information. Like, it used to be Social Security numbers. Now
Right.
it's not that anymore, but it's their Medicare number,
Right.
which is important.
Right.
A very significant information, so that significantly important information that they really, their risk factors there that we need to be
Right.
very cognizant
Right.
of.
Right.
Yeah.
So where does the funding come for your agency? Are
So-
you a state agency, a private agency?
So we're private. We are, again, we're at Elder Services of the Merrimack Valley. They're a private nonprofit, a very
Okay.
big private nonprofit. But our funding for the Massachusetts Senior Medicare Patrol Program comes from the Administration for Community Living, which is, better known as the Administration on Aging.
Mm-hmm.
And that's through the Department of Health and Human Services.
Yeah, that's interesting. So flyers, information that people can pick up.
So-
You've got flyers with you here as an example.
So I have a journal, a healthcare journal,
Okay.
and I think this is a really important tool. And so we disseminate these journals and brochure that's in the journal and a pen. Okay. This is our toolkit when we go out.
Oh, I love
And
it.
our toolkit. I call this our toolkit.
Yeah.
When we go out and do presentations across the state. They come in 7 different languages.
Really?
Really. And we have volunteers who speak Portuguese, Spanish, Korean, Vietnamese, Chinese.
Wow.
Yes. And I may be forgetting a language or two. But so we have volunteers and staff who
But you're
speak.
well versed.
Yes.
Yeah.
And so we serve a very diverse group of people. And if somebody calls us and they don't speak the language, we go and get an interpreter because we are mandated to do that as well.
Okay.
So we give this toolkit out to everybody. And I like to say, when I do presentations, I say, you know what, if you don't like the color of this, if you don't like the shape, whatever you don't like about it, go out and get yourself a little notebook or a big notebook and keep a chronological record of what happens to you in the healthcare system. Because one, we forget. And two, we never want anyone to say to us, no, that didn't happen. And you can look at your journal and say, no, it did happen on X date during X visit, and you told me to do this, and this was the plan. Very important. We really need to understand what's happening to us in the healthcare system. When did I get that vaccine? When did I have that bone density test? Because if it was 23 months ago and I have one today, guess what? It's not going to be paid for.
Right.
It's on me. So people just need to understand their benefits a little bit more. People should be reading their Medicare New book that comes out annually. Presently, we have 2020 out. 2021 is coming. People should really read that. And they're like, well, I'm not reading this book. People say that to me all the time. I said, I have a prescription. Put it by your bedside. And when you wake up and you can't fall asleep, you read it. I guarantee after 2 pages you will be
You'll fall
asleep.
asleep, right.
You don't need medicine. It'll put you to sleep, and you will be able to retain maybe a few sentences. And that's information that you'll have. It's important. People really need to look at all the preventative services that are available because there's a lot there. People need to understand, how do I do this? Well, it's in the
Right.
book. And if you don't understand, you pick up the phone and you call somebody.
Okay. Wow. And speaking of numbers, what is the number of your agency, of your office that people can call?
Yes, it's 1-800-892-0890.
Give that one to us one more time.
1-800-892-0890. That's a toll-free number. It'll ring at Elder Services, the Merrimack Valley, and you need to ask for the SMP program. Or I'm calling about fraud. I need to speak to somebody about healthcare fraud. They
Right.
will connect you to the right
Right.
person.
So are these flyers, are you able to distribute? I'm guessing as I'm looking at it, it looks like an expensive flyer to produce, so mass production may be out of the question. But are these available at many of the senior centers around
They
the
are
state?
available, and if they're not available, if somebody goes to the senior center and they're not available, they can call us directly and we will send this out. Okay? We're very diligent about sending it out to senior centers, and we send it out to the SHINE program so that SHINE counselors have them, especially now with open enrollment, which is a good thing to mention. Open enrollment is starting next month. Oh, excuse me, I'm fast forwarding too fast. It's actually October 15th.
Okay.
It's September next month. Let's keep September around
Right.
for a while. October 15th, we have open enrollment coming up, and people should be seeing SHINE counselors to get advice on which plan to enroll in, and they probably will be handing these out to individuals. I think things are a little bit different this year because I don't know who's seeing clients in person
Right,
or not.
right.
But if you want a journal, please call us and we will send you a journal.
That's good to know.
Okay?
Now, I see that you have a lot of partner agencies that you work with. So if people are in touch with those agencies can then refer them on to you if there is a question or if they
Yes.
feel that you
Yes.
have a resource
Yes.
that needs help with. Because I'm looking at the Office of Health and Human Services Inspector General, the Office of Refugees and Immigrants, SHINE program,
Yeah.
Boston Elderly Commission, certainly.
So those are all on there. They serve on our advisory committee.
Okay.
But yes, if somebody called one of those offices and said, I have a healthcare question here that I think, my bill is wrong, there's some confusion, they would send you to us. Or they would send you to SHINE, and SHINE would then say, well, this is really an SMP issue. They would there's a cross-referral that happens. We actually have a cross-referral form in place and process so that people do cross-referrals to us.
I just thought of something. Is there a statute of limitations on how far back you can go? So, if somebody gets a bill and they just pay it, and they don't think to look at it, and then a year later they take one of your fantastic workshops and they learn about this and they say, oh my gosh, you know what? I remember paying something that I wasn't familiar with. And they go back. How far back can they go back?
I'm going to say if it's a year, we probably could do something about it.
Okay.
Still, we would look into it. We would certainly look into it.
But anything older than that?
But anything older than that, I think that let's just say we would address that individually with that individual, right? But people should not hesitate to call.
Okay. But I think the key word I've heard and gotten
Call.
out of this is call, be vigilant, be
Yes.
looking at your documentation,
Yeah.
know what it is you're paying for, and if you see something that's questionable and your gut tells
you.
this
Your
seems
gut
funny,
is
I
right
don't
most of the
remember
time.
This.
Your gut is right most of the time.
Right. One of the issues that's certainly come out in the election of these hidden hospital bills that people are talking about, you think you're all done and then all of a sudden another bill shows up. Is this part of that at all, or?
Well, we will look into that with the individual.
Okay.
Yeah, we will look into that. And I think, the hidden hospital bills that they're probably talking about is the facilities, charges that get
Oh,
put in.
I see.
Yeah.
Right.
So I think it's semantics. It's, the verbiage that's being used. But We will look at any question that people have, any concerns around their bill. We will help you. We don't guarantee that we will resolve the issue in anyone's favor. You know, typically it does get resolved in the individual's favor. We hate to open up a can of worms. That's not going to,
Right.
do well by the consumer. We're there for really the consumer,
Right.
We have one of our case managers who will say, oh, well, I have two case managers. One says, why do you have to make this so hard? I'm like, let's keep digging. It doesn't smell right to me
Right.
yet, and so we just keep digging. And then I think one other case manager has sort of resolved to saying, he often says, oh, just listen to her. Yeah. And we have some really cool examples of why that, why those comments, it's like,
Right.
just keep digging a little bit deeper and you're going to find something. After a while, I think, after a while you sort of, I have that in my gut now,
Right.
it's like,
Right.
just doesn't look or smell right to me
Right.
right now.
Yeah, somehow as I've been sitting here, listening to you, I said, "No, I don't think this woman's a pushover. I think she's going to get right to the bottom of it." So you're someone who's going to be a very active advocate for people.
I think advocacy is in my blood. We try.
Right. Anything else that we should bring up before we start to wrap up here that you can think of that we haven't covered?
People need to be aware of scams.
Okay.
Aware of scams. Just this
Right.
week, I got a call, and I couldn't take the call. It was my house phone, and I'm working from home most of the week, and I got a call, and they left me a message, and it was a very scary message when I picked up the phone. It was like, I owe somebody something, money, big money, and they're going to send the police to my house, and one, that's not true, but it was really, if I was an elder and I was feeling vulnerable, it would have been really scary, and I would have called them back. And I don't know what kind of engagement they wanted by my calling them back, because they did leave me a message. And I just hung up and I said, you know what? If I owed anybody money, they'd be sending me something in the mail.
Mm-hmm.
Certified return receipt, right?
Mm-hmm.
And but some of this is very intimidating. The IRS calling, they're going to arrest you on this, by 5:00 tomorrow or today.
Right.
I mean,
Right.
those are scams. People need to just hang up on those people. The computer company, your computer's going to explode. That's happened to me. And it's like, okay, enough. So, we've gotten to the point where people don't even answer their phone anymore if they don't recognize the number.
Mm-hmm.
And so I just think people need to be really vigilant. We also heard, when COVID, in the beginning stages of COVID, we heard, and tests were limited, we heard of people coming with white coats going to individuals' homes, and they targeted elder complexes, and they were going to do their test in exchange for their Medicare number.
Oh,
So
wow.
don't,
Wow.
please consult your physicians. Be on the lookout, because there are people out there who are trying to take advantage.
Protect that Medicare
Protect that
number.
Medicare number and protect yourself.
Right.
Because you don't want to let anybody like that into your house, right? Be careful. Just be very careful. Somebody calls you about pain on the phone. If somebody called me first thing in the morning and asked me if I had pain, I'd say yes. And that's all they want is that yes. And then they will send you a load of braces. They've gotten your Medicare number somewhere, somehow, or maybe they'll get it from you. They'll talk you into it. And then you'll end up with boxes of braces in the mail. And guess what? You don't need them, you don't use them. And then if you actually do then need braces and you've already received them, Medicare will not give you the braces that you need. So be careful. Just be vigilant.
Right. Right.
Be very vigilant.
Yeah, good advice. Well, Lucilia, Prates, thank you so much for coming in today and sharing your
You're
expertise.
so welcome. Thank you
This
for
has
having
been a
me.
very interesting hour that we have spent together on the Massachusetts Senior Medicare Patrol Program. And I would say to our viewers and to our listeners, be vigilant. Protect that Medicare number. And if you need help, know that there is help out there. Certainly here in Westfield, you can go to our senior center with Tina Gorman and get information on how to find some helpful resources or to find the information on how to engage with Lucilia and her staff if you need help. But the big thing is to really look at your bills, know what you're paying for, and question anything that looks a little suspicious. Test your gut, as I've learned here. So I'm Harry Rock. This has been a special collaboration with the Westfield Council on Aging Presents of a program between Tina Gorman, Executive Director of the Westfield Senior Center, and P. Coles, producer of WCPC Westfield Cable Channel 15. Thanks for tuning in. Thanks for listening. Have a great day.